Hey, this is Jared Moss. Hope you guys are doing well. We wanted to do another follow-up video. My partner Jim Noble recently did a video on painless prostate biopsies. I thought that'd be a nice segue into what is an MRI fusion biopsy. Prostate cancer in 2018 is a little bit different. One of the things that's evolving is the era of MRI of the prostate. MRI of the prostate is very helpful in men that have an elevated PSA. We typically use this in men to identify certain areas of the prostate that may be concerning for prostate cancer. Previously, biopsies were performed randomly, just meaning that we would go in and we would sample various areas of the prostate to determine if there were any prostate cancer there. A lot of times I'll use the analogy to a patient to say, well, if I threw you an orange and I gave you a needle and I asked you to stick the needle in an orange and hit a seed, you'd probably say that that's pretty difficult. That's basically how we did prostate biopsies prior to having the ability to perform an MRI. When we perform an MRI, it gives us the ability to basically have a roadmap of the prostate. So we can look at it and say, well, there's this one small area that looks really funny. So when we go in to biopsy the prostate, we do want to biopsy the other areas, but we want to make sure that we target this area specifically. And that's why it's called an MRI ultrasound fusion targeted biopsy. In practice now, a lot of times if I see someone for an elevated PSA, I'll talk to them, I'll see if they have any symptoms, I'll perform a digital rectal exam, make sure if they don't have any abnormalities on their prostate, and then I'll talk to them about getting an MRI of the prostate. Generally speaking, the patient will be able to obtain the MRI. They'll come back and we'll go over the MRI result, and then we'll make a decision together about do we want to continue to observe the PSA and give it some more time to see if it comes back down because there's really no concerning findings on the MRI, or do we say, well, there's this one specific area that really is giving us some concern. I think we better go in and try to sample this area. So that's how the MRI is really evolved and is guiding our decision making. And hopefully we're biopsying less people, and of those people that we biopsy, we're hoping that those are the people that truly need a prostate biopsy. I hope this information has been informative and been helpful. If you have any further questions, please let us know. We'd love to help. Thank you so much.